Dimorphic fungi, histoplasma. This is a presentation for Tarleton State University Veterinary Microbiology class VETE 3317. Authors Medina Regalia, Kendra Hamilton, Laurenstein Matter Jr. Just a bit of background information on dimorphic fungi as a species. It exists in two distinct forms, a mold form and a yeast form. When cultured at temperatures 25 to 30 degrees Celsius, they retain the mold morphology, but when cultured at 37 degrees Celsius, most molds will grow as a yeast. There are 4 different types of fungi that are dimorphic. On screen, the chart indicates the morphology of each species, as well as how to better identify it within fungal culture testing. Today we will be discussing just one of these dimorphic fungi, Histoplasma. Histoplasma capsulatum species is the cause of histoplasmosis, and we will also cover some of the common clinical signs, methods of transmission, as well as treatment and prevention of the disease. Where can you find this? Mostly warm, moist climates. They're a very suitable breeding ground for histoplasma. Specifically, in these areas, it is the soil that has been enriched with bird or bat feces that is the primary source of infection. The fungus becomes airborne when our animals disturb the ground and inhale the spores. Inhalation of these spores will cause a localized infection of the lungs, and in severe cases, or in cases of an animal that is immunocompromised, the infection can become systemic. In addition to dogs and cats, humans can also contract histoplasmosis. Symptoms are nearly identical in all species, though we cannot report if an animal is experiencing a body ache, a headache, or any kind of chest pains. We can assume by their clinical signs of dyspnea and coughing that they are most likely experiencing similar symptoms as humans. Histoplasmosis is not a zoonotic disease, wherein it cannot be spread directly from the lungs of an infected animal to the lungs of another animal or human. The exposure is limited to exposure to the spores in the environment. In some positive cases of histoplasmosis in animals and humans, they may remain asymptomatic. This is partially due to the animal's own immune system as well as to the degree of the spores that they have inhaled. Most patients present with dyspnea, fever, fatigue, and pain. Radiographic evidence will often display lesions in the lungs and then later to other organs if the disease progresses without medical intervention. It is especially important to note that patients that may be immunocompromised can have the disease spread to the central nervous system. It can also affect the heart, liver, and small intestines. In these patients, early intervention is imperative for survival. Clinical findings show lesions within the lungs. The disease can also be seen within lymph node smears. The following slides feature a case study by Kendra Hamilton, one of the authors of this PowerPoint. This feline presented at her clinic with weight loss and a history of histoplasmosis. His bilirubin was slightly elevated and was the only blood evidence of an underlying illness. The ultrasound of the spleen was concerning for infiltrative disease, so further testing was commenced. The animal was radiographed, and recurrent histoplasmosis was initially ruled out. However, a cytology from his spleen, a dermal mass of the left hind limb, as well as elevated urine antigen of histoplasma, diagnostically indicated the return of histoplasmosis. The patient was started on an antifungal therapy of oral Sporanax. The patient returned a month later with continuing weight loss and an esophageal feeding tube was placed for 3 months. His final antigen level was taken and results were below the limit of quantification, and oral antifungal treatment was stopped and the feeding tube was removed. Diagnostics that can be used to detect histoplasma are blood samples, X-rays or CT scans, urine samples, tissue biopsies of the lungs or other affected organs, as well as bronchial washes. Treatment involves the use of antifungal medications, and in severe cases, treatment with amphotericin B or amphotericin B lipid complex is often suggested. The patient often is also receiving therapeutic support in the form of fluid therapy, rest, breathing treatments, and supplemental diets for weight management. Prevention of this disease can be difficult in endemic areas. In these areas, it is recommended to take precautions in the areas where bird or bat droppings are present, as well as the cleaning of chicken coops, spelunking, or the wildlife rescue of bats and birds. Individuals with weakened immune systems should seek professional assistance should they need to remove large amounts of potentially hazardous materials. Prognosis is dependent upon the animal's ability to respond to treatment. It is also largely dependent upon early intervention and if the nervous system has been affected in the animal. Want to test your knowledge? You can play an interactive game of Kahoot to assess your knowledge of histoplasmosis. You can access this game by clicking the on-screen link and using your cellular device to play the game. You can download the free Kahoot app to your phone, or you can go to kahoot.it to access this game. The link will also be available in the YouTube comment section. Thank you so much for watching our presentation on histoplasmosis. Here are some of our references. And here are some of our image resources.